Zoshi Marina Limuan, your student nurse from University of Mindanao. As for today's video, I am going to perform the IV infusion, including the starting of intravenous infusion, regulating of intravenous flow rate, and discontinuing intravenous infusion. Check the doctor's order and prepare the IV level. Wash hands to prevent the spread of microorganisms. Gather all equipment and prepare the IV solution and tubing. To save time, maintain aseptic technique when opening sterile package and IV solution to prevent contamination. Clamp tubing and cut the spike and insert into the entry side of the bag or bottle as the manufacturers direct. If an additive is ordered, incorporate it before inserting the spike into the entry side. This puncture the seal into the IV bag or bottle. Hook the IV bottle in the preparation area and allow it to fill at least halfway. Remove the cap at the end of the tubing, release the clamp, and allow the fluid to move through the tubing. The air removed from the tubing, which can in large amount act as air in bolus to facilitate accomplish of the task. Okay, ma'am, I'm going to start an IV infusion, which include administering of medication intravenously. Is it okay to you, ma'am? Tourniquet causes increased venous pressure resulting in automatic backflow, an indication that the needle is inserted into the vein. Clean the infusing area with cotton balls. Hand the needle to the doctor or to the nurse and observe inserting the needle. Release tourniquet. Connect the tubing to the needle. Support the needle with a small piece of gauze or tissue paper under the hub if necessary to keep the needle in place. Loop the tubing near the site of the entry and anchor it with the plaster to prevent pulling of the needle. Adjust flow rate according to doctor's order. Complete the label and tape it to the IV fluid bag or bottle. Okay, ma'am, can you please not make an unnecessary movement, especially to your injection site, to avoid the backflow of your blood that can cause or affect the flow rate of your IV. Do the aftercare of the equipment. Hand wash to prevent spread of microorganisms. Document the procedure and the client response. Chart the time, site, device used, solution, and rate of flow, and the physician or nurse who inserted the needle. This provides accurate documentation and ensures continuity of care. Monitor periodically to check flow and observe for infiltration and other untoward symptoms. This documents the client's response to the infusion. Review accuracy and completeness of physician's order in client medical records to ensure that correct IV fluid is administered. Do hand washing to deter the spread of microorganisms. Excuse me, ma'am, can you state your name? Okay, when was your birthday? May I see your plan? Okay, Miss Kathleen. Inspect IV site for signs and symptoms of IV-related complications such as pain, swelling, or redness. This is to report and indicate need to establish patent IV access. Observe the patency of IV tubing. Have a paper and pencil or calculator to calculate flow rate. Adjust the IV clamp as needed and recount drops per minute. Monitor IV infusion at least every hour, noting volume of IV fluid infused and rate. Record rate of infusion in drops per minute and parental administration form according to agency policy. Check for the physician's order for discontinuing. Wash hands. And assemble equipment to save time. Okay, ma'am, based on your doctor's order, I'm going to discontinue your IV infusion because your condition is already stable and you're free to discharge. Loose the tape at the venipuncture site. Don gloves. the swab above the venipuncture side, withdraw the needle quickly by pulling it out along the line of the vein. And immediately apply firm pressure to the site to prevent bleeding. Check the needle to make sure it is intact. Apply cotton balls to the IV site and tape it. Discard used supplies appropriately. Remove gloves. And wash hands. Record the amount of fluid infused to ensure accurate documentation of client's response. Thanks for watching. God bless us all.